Good morning, beautiful people, and welcome to another episode of Mental Growth, a podcast dedicated to ending the stigma around mental illness, teaching healthy mental mannerisms, and improve overall health for everyone within the community. I am your host, Chelsie Brewer. Today's episode is sponsored by Emerging Black News, who can be found on Facebook, Instagram, and emergingblack.weebly.com. Today's episode is about the most commonly diagnosed mental illnesses and different ways to treat those illnesses. And joining us today to talk about the topic is a very special guest. She hails from the DMV. She is a board-certified family medicine physician practicing right here in Jacksonville, Florida at St. Vincent's Primary Care on Edgewood. She is also the founder of DoctorMrs, where she touches on different topics from relationships to health in a relatable way in order to help us get through this thing called life. She is the wife of Donovan Calicker and a fur mommy of Marley Hendricks Calicker. Ladies and gentlemen, let's welcome Dr. Shari Calicker to our show.
Hi, everybody. Thank you for having me.
Thanks so much for joining us today. Such a pleasure having you on today's show.
No problem. Happy to be here.
All right, so let's get right into it. DoctorMrs, how have you become so successful?
So I think my success starts long before I was a doctor or a Mrs. Like you said, I grew up in Prince George's County, Maryland, where I was exposed to a lot there. Sky's kind of the limit, and I decided that I wanted to be a physician. So I went to Xavier University of Louisiana in New Orleans, and I still stand by, if you're an African American and you want to be a doctor, that is where you need to go, okay? They hit you from the ground running from the beginning, put you through all types of modules so that by the time you apply for med school, your application is already together, you have your mentors, everybody looking over everything. It's just really great. From there, I went to Meharry Medical College in Nashville, Tennessee, graduated there in 2014, and I came down here for my family medicine residency at St. Vincent's over in Riverside. So I was there for 3 years. I guess I should backtrack. I met my husband in med school. And then we got engaged my last year right before we moved down here. And so then we moved here, and then we got married my second year. I was a crazy person and planned my own wedding.
I'm sure that was fun.
Because I have control problems. So I planned my wedding my intern year, which now sounds really crazy. And then kind of during my residency, just working all those long, hard hours, I kind of started thinking, what else would I be able to do with my degree? I love seeing patients. I love helping people. But I don't really think that this is everything that God has for my life. So and this is really funny, so I was watching Real Housewives of Atlanta one night, and I saw Dr. Rachel Ross. She's a sex therapist, so she was doing some type of sex therapy something. And I just thought it was so cool that she was able to kind of integrate the two lives of medicine and reality TV, two of my favorite things. And I was like, so I did just a little bit more research about what she was doing as far as she was on the television show The Doctors, and she had her own kind of thing going on. And I kind of thought, that's something I could do. Like,
inspired.
Yeah, definitely. And thus, DoctorMrs was born.
Okay, so we kind of talked about your history. How long have you been practicing medicine?
So I've been practicing in total for almost 4 years. But as far as being out of residency, just almost my first year out of residency, which feels amazing.
Woo-woo. Congrats.
Yeah.
Congrats. Okay, so how do you balance having your own practice and being a wife?
So I think that the best way that I balance my life in general is just by being organized, being time efficient and cognizant of where I'm spending my time. This was a lesson that I probably just mastered a couple of months ago, because so when you're in residency, all of your time is spent working, like the majority of your time is spent working. So honestly, like the first year, I didn't even see my husband. Like we were passers in the night. And then kind of each year that goes on, you kind of get more and more time. And that's when I kind of started DoctorMrs. So I was kind of putting a lot of some time towards that, but really everything was going to work. So once I graduated, and now I'm working, I have a lot more time. So I just kind of started filling up that time with like anything that I could do, because now the answer was always yes, right? Because I don't have to work. I don't have to do anything. I'm just like, yeah, I'm sure I'll do
time
that.
on your hands.
Sounds great. But then I realized I'm like, well, I'm like putting all this time, like doing all these extracurriculars, and I'm not devoting enough time to my brand or to my husband or to work, or, you know, it wasn't, not at the same time, but kind of different areas require different things at one time. So I started just trying to be really cognizant of where I spend my time, how much I commit to, and that has really helped me a lot as far as keeping everything afloat.
Absolutely, absolutely. So mental health, there is a stigma in the Black community on this. What are your thoughts on that?
So I definitely think that there's a stigma in the Black community, but I definitely think that it's a stigma in every community. No one wants to talk about mental health at all. Like like I was saying before, for pretty much everybody that's on social media, it's now like the new Black. Like now everybody wants to talk about mental health. But for people that aren't really in that space, that's not really something that people are open about speaking about. As far as the Black community is concerned, I feel like the stigma definitely comes from us kind of feeling like we can't be wrong, that we can't not be on point, that we can't not take care of our affairs, that we can't be in charge of our lives. I think for a long time we were told that we could not. So now that we're given the opportunity to, we don't want anybody to look at us differently because we have mental health issues. So we either don't talk about it, or we take it to church and pray about it, and hopefully God will deliver us from depression. But a lot of times we don't go beyond those two.
Right,
steps.
absolutely. Well, you said earlier that it's become a trend. I think that's a new 2018 thing, because this month, with it being Mental Health Awareness, I've seen a lot of people, you know, come out the closet, so to speak, and talk about their struggles, and which I think it's a good thing for people to finally, you know, tell their story and help others through that.
I definitely agree with you. I've seen, because last year I kind of touched on mental health, and it was like,
not much feedback.
Not much feedback at all.
Yeah.
And like this time it was like everybody, and then people were like, oh, you should do a hashtag, like all this. And I'm like, where were y'all at last year? Like,
amping it up.
Like, you know, you had these same issues last year, girl. It's fine.
So what, with your practice, what are the top mental illnesses that you diagnose with your patients?
So definitely the top 3 things that I see in my practice are anxiety, depression, and abnormal grief reaction, or just not responding to grief normally.
Right, and how common are those illnesses, would you say?
A lot more common than people think. There's definitely a lot of undiagnosed mental illness that is attributed to other diagnoses. Sometimes people come in, they have headaches, complaining of headaches, or just not being able to sleep, or like not feeling like they want to eat, or just being irritable. And all those things can be attributed to anxiety or depression. And so when I kind of hear those trigger words, I kind of delve deeper to see, you know, is there something here, or is this really just, you know, face value? Because a lot of people aren't going to come in and say, hi, I think I'm depressed.
Right.
You know, they're going to come in and say, I keep snapping on everybody and I don't understand why, or, you know. something like that.
So would you say anxiety and depression are curable mental illnesses or manageable, lifelong?
That's a good question. I think that I'm going to say manageable because I feel like we will all go through ebbs and flows, and there will be periods where you are sad and you're not really able to shake it, and there will be periods where you're like, you have so much going on that you don't really know how to
just stop.
Exactly. So I think that the wonderful thing about therapy is that you learn the tools to, number one, recognize when you're in those spaces, and number two, do modifications, whether it be breathing or, like you said, just stopping, taking a break, doing a whole Netflix and chill day, you know, to yourself, just kind of regroup. But it teaches you how to kind of manage those times. So I definitely think manageable is the better word.
Well, I agree that you said, you know, you're an advocate for therapy and talking it out, which I agree with you. So I feel like maybe a therapist, everybody's, you know, so prone, no, I'm not going to a therapist. I'm not going to a therapist. But going to them and getting those skills, as you said, coping skills to work through those problems is definitely beneficial, so to speak, like a life coach.
Yeah,
just having someone to kind of coach you through those hard times, for sure.
And I always tell people, like, going to a therapist doesn't mean you have to go there for the rest of your life. Some people just need to go for coping skills that I, unfortunately, because I'm only given 15 minutes to talk to you, I can't talk about all of your health issues and teach you coping skills in 15 minutes. So why not send you to somebody who's studied this, who knows all these things, and you have a whole hour to decompress whatever is going on.
Focus on that.
And focus on that. Get the skills that you need so that, you know, you can go for 1, 2, 3 times and be done.
Absolutely. So we talked about, you know, therapy as one way to treat these illnesses. What about common medications prescribed?
So for some people, I definitely think medication is necessary because there are people that literally aren't living their life. They're not functioning. And so sometimes you need medication in combination with therapy just to kind of have something to temporarily bring you up while you're working through your garbage. Like you just need that, or bring you down if you're anxious. So the common medications that we use are the SSRIs, which are the selective serotonin reuptake inhibitors, and then the SNRIs, which are the serotonin and the norepinephrine reuptake inhibitors. And what they do is there's a neurotransmitter called serotonin, and it's in your body. And what it does is it controls your mood, your sex drive, how much you eat, your activity, all of that. This little tiny thing in your body controls your every move there. And so what those medications do is they allow more of that neurotransmitter to be in your body so that you feel better and you want to eat or not eat as much, or you want to sleep, or you want to do, you know, more than what you were doing before you were taking it. And it's definitely not, like I said, I don't recommend, you know, just medication only. I feel like it's still a Band-Aid because you still haven't dealt with anything. You haven't worked through what got you to there in the first place. But for people that aren't ready for therapy, I definitely will start them on that, especially if they're, like I said, if they're just kind of stuck and not really able to function the way that they would like to live their life.
Absolutely. So we talked about therapy. We talked about common prescribed medicines. What about natural remedies?
So we do want to give my disclaimer. I want to give my disclaimer that even though we're talking about natural remedies, do still recognize, you know, if you're doing these natural remedies and you're still kind of in that funk, understand that at that point you do need to seek help. Okay. But really, it's the same thing that they tell you to do for everything else. and that is healthy diet, keeping junk out of your body, processed foods, all those great things. And exercising. And exercising doesn't mean you need to be in the gym for 2 hours every day. Exercising can be 30 minutes for 5 days. It can be 3 days worth of 50-minute exercises. So don't think that you need to be pumping iron to get your depression away.
Start with 15 minutes. Start with 15.
Exactly. So yeah, doing that, making sure that if you can, that you're getting enough sleep. Deep breathing is really, really a great, wonderful thing. Deep breathing exercises are phenomenal.
Meditation and yoga. It's the new things. Yes.
Yoga is phenomenal. Get into it. Yeah. So anywhere where you can kind of block out
those negative thoughts.
Mm-hmm. Exactly. And I mean, you can tell the difference in your body when you eat crap or junk food. You know, when you have your cheat day and then the next morning you're like I feel terrible, my body, I'm so tired. Versus when you're eating like clean or vegetables, lean meats, things like that, and you wake up in the morning like feeling like Superwoman. So those are the same things that can help with your anxiety, depression, things like that.
Okay, so mental illness is something that is definitely an internal battle for most people. So what are some symptoms or ways that we can tell someone is suffering from a mental illness?
So if you haven't seen your friend in a while, I would check on them.
Right. Yeah.
You know, if you just notice in general, like your friend or your spouse, they used to like, I don't know, going to the movies every Tuesday. And then one day they're just kind of like, oh, I'm not really feeling it. And you're like, oh, okay, maybe you just don't want to go to the movie. But it becomes like an ongoing beyond 2 weeks type thing. That's something you consider. So anything that you're used to doing or you've noticed that someone is used to doing that they're not really doing anymore, you can just and you don't have to say, hey, are you depressed? My personal favorite way to ask is, so how's your mood? Like, how are things going? Blah, blah, blah. So I think that's a very good way to ask, and people are very receptive to that. Other things, I mean, of course, the traditional just kind of crying and not really knowing why you're crying or not really able to be in control of your emotions. Right. Right. Eating too much or not eating, sleeping too much or not sleeping at all. Those are really the big things. And anxiety and depression kind of go hand in hand. So either one of those can kind of give it away for anxiety or depression. Anxiety kind of comes along with a little bit more worry, racing thoughts, or like uncontrollable worrying. We all worry. Those things are normal. But uncontrollable worrying, racing thoughts, like when you're trying to go to sleep and you can't because you're just thinking about everything that happened that day or what's going to happen the next day. So yeah, those are the things that I would look for as far as depression, anxiety.
Okay, and where can these people go to seek help?
So if you don't have a primary care doctor, I would definitely get one. So you should be able to go to your primary care doctor, and they should kind of be able to point you in the right direction as far as medication and therapists and things like that. I know it's really helpful in my office. We actually have a therapist in-house, so it's really easy to kind of...
one-stop shop.
Exactly. So it's very easy to kind of just, as long as she's not seeing a patient, I'll just grab her, especially for those people that are like on the fence with therapy. I was like, just hold that thought. And I'm like, hey, I have this patient. I think they're
got really a code benefit. For it, huh?
Right. Right. I think you really benefit, but I think they're kind of on the fence. Do you mind coming to talk to them? So definitely going to talk to your PCP first. Talk to your friends. Some of your friends are dealing with mental health and they haven't talked to you about it. They have therapists. So that's always the best way to find a good therapist is word of mouth or referral. Right. So talk with your friends, your family. There's a lot of non-traditional spaces to do therapy. A lot of online texting, talking. So those are definitely things that you can look
up and come.
Definitely. that you can look up online. So there's a lot of different avenues that you can reach to get help that you need.
Just Google it. Huh?
Just Google it, man. It's a powerful thing. Great search engine.
Well, Dr. Calicker, I thank you so much for joining us today on today's show. It has been such a pleasure having you here. To learn more about Dr. Mrs., follow her on Instagram, Twitter at This Is Dr. Mrs., Facebook page is Dr. Mrs., and check out her website at www.drmrs.com. That's all the time we have for today. I want to thank my listeners out there for taking the time out of your day to tune in. Catch us next Thursday at 10 a.m. for another episode of Mental Growth. And as we bring this episode to a close, I want you to repeat this after me. I am my thoughts, and I choose what I think. I am fully present and in the moment. I have a mind free of worry and anxiety. I am happy. I am the powerful creator of my life. I am strong. I matter. I am worthy. I deserve to love myself more. I am thriving.